welcome back to Body Beautiful. We'll be taking your calls with any questions you might have about breast augmentations and lifts for the doctor. That phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment. So be ready to jot that down. And something we always have to say here, but any advice we give you today, you'll certainly want a second opinion as well. Let's go right to the phone lines. We have some people who've been waiting for a while. Fahima from Walnut Creek, good morning.
Good morning, Vicki. This is Fahima calling.
Hello. Do you have a question for Dr. Mealy?
Yes. Actually, my size is 34 double. I'm not double D, but it's D. But I can wear double D, and it's a little hanging also. But I don't want to have a cutting on my, on my breast. I was just wondering if we can do without cutting the lift with a little implant.
It's possible. It depends on what size you're trying to go to. And it may seem counterintuitive.
With any size, my size is okay.
The size is okay?
Need a little lift without cutting. We just put a little implant, so that makes a little lift.
You'll see that a lot on the internet, and it sometimes works, but the nipple has to be in the right position, so it's hard to know if it's appropriate for you, but it certainly is done. There are times, even when I do reductions, where I'll use a little implant in order to give some fullness at the upper part of the breast. There is also a technique of breast reduction that uses liposuction. I know you say your size is okay, but sometimes reducing some of the size of the breast at the lower pole will allow that to shrink and move up, but it can't be a big change in size. The reason we don't do most breast reductions that way is it tends to make sagging worse rather than better.
Thank you, Fahima. Hopefully that answered your question. And if you're in Walnut Creek, you're pretty close to the doctor, so maybe you can give him a call. We have another caller, let's see, who doesn't wish to be identified, but she wants to know, is there an age?
This is a very private area.
I know, but it is a private area.
It is a private area.
But don't worry about it. I'm happy to ask the question.
Okay, thank you.
This caller wanted to know, is there an age limit on implants? And she didn't state how old she was.
Sure.
Is there?
There is. The FDA has recommended 2 different age limits depending on the types of implants. Saline implants, the age break is at 18. And for silicone implants, the age is 22. And that pertains to just the cosmetic procedure. There are people who are born without a breast or without one breast. For the congenital procedures, then those ages do not apply.
Okay, and how about on the upper end? Are you ever too old to get this procedure?
Not so much too old, but maybe too unhealthy. If someone has a lot of medical problems, it's not going to be worthwhile. And I've seen people who are 20 years old who have a lot of medical problems who should not have the procedure.
Right.
So the age itself does not
So as with any
matter.
procedure, you need to have a thorough checkup so you know where things stand.
Yep.
Okay.
It's the law these days.
Okay. We have, Stephen from Fairfax has a question. Apparently he had some pectoral muscles, implants put in.
Implants? Yeah, there's a different type of implant for men. They tend to be solid implants rather than silicone filled or silicone gel filled. They tend to be a hard sort of rubberized plastic. So it's a different procedure.
And why would men want that? Just to give more definition
if they're
size, yeah.
Some men have, just like women, have very flat chests, and they want to have a little bit of a bulge there. We're not usually making them D cups, but just to improve the overall shape and contour of the chest.
Okay.
It's not something I do personally. I think that it's not a procedure that's perfect. If we had a procedure that worked more reliably, I'd be happier to do it.
All right, and these implants, is there a warranty on them? How long do they actually last inside the body?
No, there's a warranty. If the implant ever deflates, it's always replaced. At least that's from the 2 manufacturers here in the U.S., which are Mentor and Allergan.
Okay.
The warranty also includes money towards having the surgery if there's a deflation within the first 10 years.
Okay, we've just got a quick... Jane from Hayward, can you ask the doctor a really quick question?
Yes.
You're on. You're on the air. What's your question? Jane?
Yes.
Oh, what's your question for the doctor?
My question was, if you have really large breasts, is it difficult to reduce them?
Not for me, but I've had a lot of training. It's usually not difficult in terms of the patient either. The reduction surgeries are something that are done in a surgery center under anesthesia, and then if it's a really large reduction, sometimes I'll even keep my patients overnight just to be sure they're comfortable, that they're doing okay with the anesthesia, they're waking up appropriately.
Okay, Jane, hopefully that answered your question. I mean, so really it doesn't matter, it doesn't affect the size, how long you're going to recover. I mean, just surgery is the surgery.
Yes, yes. Yeah.
Right.
Surgery, the recovery is very similar. Sometimes little lifts will have as long a recovery as a big reduction. It's amazing how much better some of my reduction patients feel, even in the operating room, right? Just as they're waking up, they already feel better.
All right, unfortunately we're out of time. We can't take any more phone calls, but for more information on Dr. Mealy, you can call him at 925-943-6353 or check him out on the web on both drmealy.com and also San Francisco Plastic Surgery blog.com. There's also a version of his website in Spanish at Cirugía Plástica, sanfrancisco.com. Thanks very much for joining us, Doctor, and join us next Monday at 11 o'clock for another edition of Body Beautiful. Have a great day, everybody.